Terri, the floor is yours.
Thank you very much, Shardul, and thank you to OECD for inviting HPSA to this event. We read the report with great interest. Canada has had or established our first program in 2007 in British Columbia, which is the farthest west province in Canada. And today we manage seven separate programs, and some of those are Sharp's take-back programs in 4 Canadian provinces. There is pending regulation in an additional 3 provinces, which will mean that the HPSA will operate in the majority of Canadian provinces by the year 2025. As you said, we're governed by a volunteer board of our stakeholders. And some of the issues I would like to bring particular attention to with regards to some of the policy and challenges that we have in Canada. Consumer awareness certainly is first and foremost on our mind. We must drive consumer behavior before these programs are effective. In 2021, HPSA conducted a survey of consumers and their behavior and awareness around take-back programs. And although about 80% of Canadians said they were aware of what to do or how to dispose of medications, a little more digging revealed that basically 65% of Canadians know what to do with medications and how to take them back. Particularly challenging to us and in line with the OECD report is liquids and over-the-counter medications are not as often disposed of properly as prescription medications. And this seems to be related to the concept that these medications aren't as harmful to the environment as prescription medications. Another interesting finding is younger Canadians tend to know less about take-back programs than older Canadians. That may be in line with the amount of medications that older Canadians tend to consume. But at the same time, my takeaway from that is younger Canadians are much more active in the environmental space, and climate change is an issue. So we need to focus our attention on establishing a rapport and a communication channel with younger Canadians. We also discovered that pharmacists are the primary source of information for consumers, and that's where they learn the most about how to take back their medications. So HPSA has targeted pharmacists on proper disposal methods. So we have an objective basically to move those survey results and to reach more Canadians and leverage the younger Canadians, as well as focus on creams and ointments and proper disposal. We do work with individual provinces as well, based on their individual needs. An example of that in Metro Vancouver, which is the largest city in British Columbia, we work with them in promoting a campaign called Unflushables. That's been working very well at a local level, and we try to tailor our communication needs to our segments as well as our provinces. So as I mentioned, we have 3 additional provinces with pending regulations. One is Quebec, which is a very large province. So we're looking forward to rolling that out in the next year. And before I pass on the floor, I wanted to talk about a couple of additional challenges that weren't mentioned in the OECD report. COVID has brought on some unusual challenges to take back programs in the form of cost maintainment. Plastics have gone up, and we supply those bins for collection, as well as transportation costs have skyrocketed. So we have a challenge of managing costs over take back programs. And as Spitav mentioned, we're an EPR environment, so our industry funds our programs. Equal participation is also extremely important in a take back program. The importance of avoiding free riders when everything is commingled, and we do this on market share. It's important that we manage all participants. So that's oftentimes a challenge. It's important as well because we have multiple provinces. Some are regulated, some aren't. As new provinces come on board with an EPR regulatory environment, that there's consistency. So we're one organization. We're the only EPR representation for manufacturers in Canada. So rolling out multiple different programs would be extremely tenuous for us. So we try to ensure that the regulations are fairly consistent. The other issue that was brought up in the report is the prevalence or increasing prevalence of mail order pharmacy. And we struggle with this as well. particularly around OTC and natural health products and consumers accessing mail order pharmaceuticals. Where do they come from? How do we account for that? How do we ensure that there's an extended producer responsibility attached to that? And the last thing I would bring up, which may not be an issue in some other countries, but Canada we have a challenge with access to incinerators. So there's always that as we bring on new programs in new provinces. Where do we transport this to? Do we have access to an incinerator? So these are some of the challenges in Canada.
Thanks very much, Terri. No, really interesting points. I mean, this issue about age and the difference in the level of awareness